Hi, my name is Ashley and this is Riley. We'll be your nurses today. First, can you please give me your full name and date of birth?
My name is Carl Kaiser and my date of birth is 10/12/1987.
Thank you. What would you like to be called today?
Carl's just fine, and this is my wife Jebediah.
Hey. It's nice to meet you both.
So, after being discharged from the hospital, it is important for us to make sure that patients are cautious of pressure injuries. So, we're going to be teaching you a little bit about them because prevention is our priority. What do you guys already know about pressure injuries?
Are they called bed sores?
Yes, pressure injuries are commonly called bed sores. They can form when pressure is applied to the skin over long periods of time and are a particular risk for when a patient is bedridden.
Why is my Carl at risk for pressure injuries?
People will move and shift their positions unconsciously when they sense pressure or discomfort, and this shift in position helps reduce pressure injuries by alleviating the pressure on that specific area. Unfortunately, you are at an increased risk due to being chair-bound and lack of sensation in your lower extremities. Lack of bladder control due to your paralysis also increases your risk.
Nutrition is also essential. So, can you tell me a little bit about your diet?
Yeah, I eat a lot of meat and sometimes some vegetables.
Okay, that's awesome. Getting enough protein is really important for skin integrity and healing.
As nurses, we use the Braden scale to assess the risk for pressure injuries. Carl's Braden scale score is 12, which is a high risk. There are 6 categories that we evaluate when looking at pressure injury risk. They are sensory perception, moisture, activity, mobility, nutrition, and friction or shear.
So out of all of those, which one is the biggest concern for me?
Since you can't feel from the waist down, it would be harder for you to sense an injury forming. Moisture can be a problem with patients with a lack of bladder or bowel control. Friction and shear become a problem when assisting someone to rotate in bed from the skin rubbing against the sheet.
How often and at what point should we be checking for the skin for pressure injuries?
When rotating, bathing, or changing his clothes, make sure to thoroughly check the skin for any signs of redness or skin breakdown. Make sure to always check the bony prominences like the base of the spine, the back of the heels, and the back of the elbows because those are the most vulnerable to pressure injuries. Carl needs to also rotate at least every 2 hours. This is a great time to check his skin. We will show you at the end of our discussion how to safely rotate him.
What else do I need to do?
Keeping the skin dry and checking the catheter site to make sure there is no overflow or leakage is important. Also, make sure that there is no fecal incontinency. Make sure that you are checking daily for signs of pressure injuries.
A specific lotion or cream that can help with preventing the pressure sores. No, right?
After cleansing, make sure to apply a barrier cream to prevent skin damage from moisture. And there are also pressure assistive devices for chairs and special beds and pads for elbows and heels that help protect the skin. Here are some of the resources we printed out for you.
Is there a specific diet I need to follow?
Diet and hydration are important, so we need to make sure that you are getting adequate nutrients. How much water do you normally drink in a day?
Oh, I'd say I drink about 8 cups of water a day. Is that right, Jebediah?
That is right, Carl.
Okay. The recommended amount for men is currently 15.5 cups of water per day. Make sure to eat enough calories and protein. Here's some information on good nutrition and fluid intake.
Okay, so how do I know if a pressure injury is getting really, really bad?
There are 6 stages of pressure injuries. The first is discoloration of the skin, usually redness without blanching. To test for blanching, press on the area. It should turn white but return to normal color after relieving the pressure. The second stage is an open but shallow injury. Sometimes this may be a blister, and there should be no sloughing off of tissue or bruising. The third stage is a deeper injury with loss of tissue. At this stage, fat tissue is visible, but tendon or bone are not. The fourth stage is extensive tissue damage to the point where tendon or bone are visible. There are unstageable pressure injuries, where the stage can't be identified due to decaying of tissue and other sloughing that can make it difficult to see the wound bed. Finally, there are deep tissue injuries, where the skin is discolored, painful, and has a change in temperature. It can become blistered or boggy. Any stage of pressure injury could become serious. You should always notify your healthcare team of pressure injuries.
Okay, so when we see any redness, we should notify the home health nurse.
Always notify the nurse of any changes or worries you might have.
Do you have any questions for us before we move on to showing you how to safely rotate?
No, I don't got no questions, thanks.
That's good, but please feel free to reach out to us if any questions come to mind later on. Do you mind if we demonstrate to you how to safely rotate?
I don't mind at all. Go for it.
Alright, so here we have Nurse Ashley lifting Carl's legs to the other side of the couch. Nurse Ashley asked Carl to lift up her body as much as he can with her upper body strength. Now Nurse Ashley is turning Carl to the side using the lower back of the knee and kind of upper back area, kind of by the shoulder, to place pillows in between to relieve pressure. About every 2 hours she will change positions, and she was also making sure Carl is comfortable and is still not going to fall off the couch, and she will be checking every 2 hours, make sure she's still comfortable, change positions, and checking for any pressure injuries.
Okay. Yeah, I eat a lot of meat, and sometimes...
Go.
Yeah.
Stages of pressure injuries.
When do I
You'll need to keep the skin dry and check the catheter site to make sure there is no overflow or leakage. Also make sure there is no fecal in...
Okay, miss. You got this.
Am I saying nice to meet you again?
No.
You said it like 4 times.
I mean, if it helps her.
Okay.
I can.
Okay. You got this.
Am I saying nice to meet you again?
No.
You said it like 4 times.
I mean, if it helps her.
Okay.
I can. It's nice to meet you both.
Oh,
Come here. She can